Welcome back to Pandemic Pill, Favipiravir for COVID, the podcast diving into the science of Favipiravir's role in COVID-19 research. I am Kanak, and each episode we unpack a new technical angle with top experts. Today we are on episode 5, Why Favipiravir struggles against COVID-19. We will explore why studies show favipiravir efficacy against SARS-CoV-2 is limited or inconsistent compared to other antivirals. Joining me is Aseema Mishra, a microbiology researcher with experience and expertise in antiviral studies. Welcome, Aseema.
Thank you so much, Kanak. I'm excited to break down the challenges of Favipiravir faces in COVID-19 research.
Yes, let's get started. We have seen favipiravir potential in early episodes, but today we are zeroing in on its limitations.
Right.
Can you give us a big picture view of why favipiravir efficacy against SARS-CoV-2 is often inconsistent or I would say limited compared to other antivirals? What is your take?
Studies show that Favipiravir does not consistently deliver strong results in mild to moderate COVID-19 cases, often failing to significantly shorten the symptoms or prevent worse outcomes like hospitalization. Compared to other antivirals, it's definitely less effective due to the way SARS-CoV-2 resists its effects and differences in how patients respond and the stronger performance of newer drugs. And this has come up repeatedly in clinical research, painting a clear picture of Favipiravir's challenges.
That sets the stage, I guess. And what specific studies highlight these limitations of favipiravir performance? What do you think?
Well, one key study looked at 156 outpatients with mild COVID-19 in Japan. It found that favipiravir cut the symptoms duration by about a day and a half, 12 days compared to 13.5 days without it, but the difference was not meaningful enough to stand out statistically. And it did not stop the disease from worsening in some cases, even. Another study in Saudi Arabia with 231 patients showed even less promise. Favipiravir took 10 days to clear the virus, while the placebo group cleared it in 8 days. And recovery times were the same at 7 days. That trial was stopped early because favipiravir was not making a difference.
Those are tough results for favipiravir. Uh, can you tell us how does it compare to other antivirals like Paxlovid or Molnupiravir in these kinds of studies?
Well, yeah, it lags behind significantly, I would say. Paxlovid, for example, was tested in over 2,200 patients, in over 2,200 patients with mild to moderate COVID-19 and cut hospitalization rates by 70%. Only 0.8% of patients needed hospital care compared to 2.4% in the control group. And molnupiravir studied Molnupiravir, which was studied in nearly 1,500 outpatients, reduced the risk of reduced reduced the risk of hospitalization or worse by about 23%. When researchers compared these drugs head to head in large analysis, favipiravir ranked very lower on the scale, often showing only slight improvements like shaving a day off fever in some cases, but nothing consistent or impactful for preventing severe outcomes.
That's a stark contrast.
Yes.
Uh, what's going on biologically with SARS-CoV-2 that makes favipiravir less effective?
Well, SARS-CoV-2 has a built-in defense that trips up favipiravir. The virus uses a protein to proofread its RNA, fixing errors that favipiravir tries to introduce to stop the replication in the virus. And this makes it harder for favipiravir to disrupt the virus compared to its effect on other viruses like influenza. Molnupiravir, on the other hand, floods the virus with so many errors that it cannot keep up. And Paxlovid attacks a completely different part of the virus, avoiding proofreading issue altogether. These differences give other antivirals a clear edge.
Okay, that means proofreading trick is a big hurdle.
Absolutely.
Are there any specific patient groups or trial conditions where favipiravir limitations are especially clear?
Well, yes, the data shows that favipiravir struggles most when treatment starts late, say after 5 days of symptoms occurrence, because the virus is not replicating as much by then. So the drug has less to target. One study with 200 patients found no benefit at all in those treated after a week. It also performs really poorly in patients with high viral loads, where it only slightly sped up the viral clearance by about 15% in a group of 168 people, but did not improve symptoms much. And in high risk patients like those with diabetes, favipiravir showed almost no advantage in a study of 120 people, while other antivirals did much better in similar groups.
Means the timing and patient factors really seems to matter. How have these findings shaped the way researchers view favipiravir for COVID-19 especially?
Well, researchers have cooled on favipiravir by now. The data shows it's not a top contender, definitely, especially with strong options like Paxlovid available. And most now see it as a backup only, maybe useful in very early cases or places without access to better drugs. But its inconsistent results have shifted the focus to antivirals that pack a bigger punch to the virus. And these studies have also pushed scientists to think harder about designing drugs that can outsmart SARS-CoV-2's defenses.
Well, that's a big shift in perspective, I guess.
Yeah.
Before we wrap up, what's one key takeaway from these studies, things that our listeners should hold on to?
Well, the biggest takeaway is that favipiravir struggles against SARS-CoV-2 come down to the virus's ability to resist it and the need for very early treatment to see any effect at all. It shows how tricky it is to repurpose drugs and why we need to research to find the right fit for each virus.
Yeah, that's a sharp lesson, I guess. Thank you, Aseema, for walking us through favipiravir challenges
My
with
pleasure.
such clarity. Listeners, join us for episode 6, where we will dive into favipiravir dosing regimens in COVID-19 research. And if you are joining Pandemic Pill Favipiravir for COVID, please subscribe, rate, and share. I am Kanak, and we will see you next time. Thank you.